And in the next module, I will be covering only about asthma exacerbation. See you all. All the HCM viewers, I am Dr. Asmitha and I have finished 3 modules of asthma management. I will be covering the last but not the least on asthma exacerbation. Now let us see what we will do. What is status asthmaticus and management of severe asthma. That is what I am going to cover. Identify the high risk patient. So if you have a patient who has past history of increased exacerbation, who has got persistent reversibility on spirometry and who has persistent wheeze, in control status, they have daytime problem and nighttime awakening. Those are the patients and who have got more than 20% of PEFR reversibility or variability during day and night. That are the patients who are going to have exacerbation. Educate the patient, give them a written plan, and then safety net when the symptoms arises. So what does GINA says about it? So this is the GINA management plan of usual asthma. Now from usual asthma, if they have got only mild symptoms, they can just increase the dose of their MART treatment, which is formoterol and ICS, and they can go. Now increase reliever as needed, continue maintenance ICS, and use an action plan template, which I am going to show you just like this. So green is normal mode. If asthma flare-up happens, if over a period of 2 to 3 days, my asthma symptoms are getting worse or not, I am using more than 6 budesonide, I should continue or I should contact my doctor. So here you should contact my doctor. If more than 12, that is more than 6 times, 2 puffs are using. Now red signals are symptoms getting worse very fast, extreme difficulty, they can't even finish one sentence. Please go to doctor immediately, sit upright, stay calm, take one inhalation of budesonide formoterol, wait for 1 to 3 minutes. If there is no improvement, take another. If only albuterol is available, take 4 puffs. Start a course of prednisolone tablet. Most of the times in country like India, you can see your doctor immediately. Now asthma exacerbation in primary care, prompt to consider differential diagnosis, just quickly rule out cardiac failure and other probabilities. Mild to moderate exacerbation, you have to see patient saturation if it's 93 to 95%. For adults and greater than 94% children, that is where you can manage at the primary care. Initiate or increase the ICS containing treatment, start nebulization, assess again, review the risk factor, check the inhaler technique, further review is planned for 2026. Now, in key changes in 2025 about asthma exacerbation in emergency department, where the life-threatening exacerbation happens, what we do is target saturation is 93 to 95% and 94% for children. Now, like when do you decide it is mild to moderate and when you decide it is severe? If the patient is talks in phrases, prefer sitting to lie, not agitated, respiratory rate is increased, accessory muscle not used, pulse rate is around 100 to 120 and PFR more than 50% predicted variability. Now short acting beta-2 agonist, controlled oxygen, moderate exacerbation, add ipratropium oral corticosteroid. So mild or moderate can be managed even at OPD level, while severe exacerbation, monosyllables, talks in words, sits hunched forward, agitated, respiratory rate is more than 30, accessory muscles are being used, saturation is less than 90. Here is the time when you have to start IV magnesium along with all the things which you did last time, but here you have to start everything IV and nebulize. Now, if continuing deterioration, you might have to go to ICU for severe asthma, and then you have to reassess with FEV1 and all. And I believe that most of us have handled asthma exacerbation. Just remember that asthma exacerbation is always more severe than COPD exacerbation. They will not give you time. I think my video on how to use inhalers and why inhalers are more useful than normal medicines I have given on YouTube, and you can go through that. And this is recently we observed World Asthma Day. The particular title for this World Asthma Day was, the theme was make inhaled treatments accessible for all. However, I denied it. It is not only about accessibility, it is more about acceptability. And I am sure that with my this class, you will able to teach your patient why inhalers are better treatment for asthma and not the tablets. Thank you so much for listening and watching this particular module. I will be coming up with MCQs and you may try for getting the certificate. Have a good day.